Hi, I'm Vanessa Howe of Howe Resonance Technologies and the CranioSacral Institute of Michigan. Today, I want to talk to you about tethered cord syndrome and frequency-specific microcurrent. This has actually been a big topic in social media, so I thought it was time for me to kind of jump in there and kind of share how we treat it and some of the results that some of our clients are having. So what is tethered cord syndrome? It's actually a newer term. I've been afraid to say physical therapist for almost 30 years, and it's actually relatively new. Although I have to tell you, as a craniosacral therapist, I've been treating these types of adhesions for over 2 decades. So let's talk about what tethered cord syndrome is. First, from a technical perspective, it is an adhesion that forms in the dura. The dura is a connective tissue that goes around the brain and the spinal cord, attaching down by the sacrum. So what happens is you get adhesions that usually are in the lower back or lumbar area that create problems, as well as you can also get them in the upper area as well. I've been treating tethered cord for over 20 years as a craniosacral therapist. That technique actually works at releasing those restrictions through our hands. I brought in frequency-specific microcurrent back in, I have to think about it, 2005, a very long time ago, and I was one of the earliest instructors in that technology. That technology is most known in professional athletics. It's very popular in the NFL as well as many other types of athletics. And as an instructor in that work, I also did work in that area as well. What we do with frequency-specific microcurrent is it's a very, very small type of current, and it is an electrical stim device. And it puts in very small electrical currents into the body. It has been shown to have anti-inflammatory effects with specifically the spinal cord, but other tissues as well. And that's really how this became a big topic in the world of tethered cord. One of the things that we find with folks that have tethered cords, they have inflammation in the spinal cord area, and that is probably one of the things leading into the symptoms. The symptoms that people report are things like spine pain, back pain, but also more significant nerve issues, nerve pain into the legs, also the arms, sometimes into the head, even to the point of having nerve problems that affect the bowel, bladder, and the ability to use the muscles of the legs. This is actually a very significant problem, and for those folks of you who are living with it, it is a very daunting task, right? I don't have to tell you that. So frequency-specific microcurrent has been shown, as I said, to reduce inflammation in that spinal cord. There was actually a viral post about 1.5 years ago that brought a lot of attention to the use of frequency-specific microcurrent and this tethered cord syndrome. And that's because this person used frequency-specific FSM, frequency-specific microcurrent, over about 6 months and was able to significantly reduce her symptoms. I feel that it's very fortunate for that person, and I'm glad that she had good results. But as an instructor and the person who originally taught how to treat the dura with frequency-specific microcurrent, it's probably not the most efficient way. And that's part of the struggle, is a lot of folks are wanting to find this type of intervention for themselves and for their healing. But the traditional model of frequency-specific microcurrent is you take a course, you learn how to use all the frequencies, and you create many times your own programs. So you'll end up with folks who really are not in the healthcare professions at all, but are desperate, and they're spending many, many thousands of dollars in equipment, in training, and then feeling like they have to, on top of it, go out and create their own programs. I did HoweRT, Howe Resonance Technologies, the microsport specifically, in order to meet a need for people who really wanted the benefits of expert FSM, but in something that was completely pre-programmed. This literally comes out of the box this way. We can hook them right up and they just push go and start their treatments. We do have programs that are specific for tethered cord syndrome. We find that they're very helpful. And I think actually it's a great time. Let me share a story of Casey. And this was just a great story. I knew that she would give us a great story because she's been so excited. Casey shares that she was facing a second tethered cord release surgery, tethered cord spinal cord release surgery, which is really the only traditional medicine intervention for this condition. And then she came across some testimonials about FSM machines. She said, I decided to write one and see what it was all about. Only 24 hours later, I was sold. And it was and continues to be a shocking turnaround in my tethered cord symptoms. My physical therapists and chiropractic providers showed notable improvements in my leg strength and my pelvic stability. I have my ups and downs a bit. I am so thankful for FSM has allowed me to live an active life without additional neurospine surgery. Thank you, HoweRT, for giving me my life back. What I love about Casey's story too is when Casey actually is in the same state as me. I'm in Michigan. And so her intention was to come and see me in person to get the benefits of the hands-on in addition to the FSM. Because I was actually in bed with COVID, that was not possible. So I said to Casey, we really don't have time to really kind of wait on this. She had that surgery scheduled. We needed to have her getting that treatment right away. And while she was like, I'm not really sure if I can do this on my own, we're like, we know that you can. We supply units all over the country. It was within 36 hours that she had those changes and she was training it herself. And that's truly one of the things I love about the microsport model. We take expert programs that are easy to use, easy to understand, and we empower people to use them on themselves safely, effectively, and literally right outside of the box. So we'll set up my assistant, Allison, and you can see how easy that is. Microsport is super simple to apply and get started. So we're gonna do, this is actually the setup we use for the tethered cord. We're gonna put the positives up by her neck, the negatives here on her low back. We'll just go to the program that we want and push start. That's it. So now Allison's ready to start her treatment, and she's on her way to healing and pain-free life. HoweRT could be your solution for pain and healing if you suffer from tethered cord syndrome. If you'd like to hear more, visit our website at www.howert.com. Reach out to us today to find out how we can help you be your best you.